My name is Dr. Peter Nierman. I have over 30 years of experience working with children, many of those years doing inpatient work. And I'm hoping that one of the goals of this video will be to introduce you to and give you some set of expectations of what you can expect after your child is hospitalized at Aliso. Somewhere along the line, it's been decided that the hospitalization would benefit your child. Our most important goal, that your child maintains their safety and that after a short period of time, they're ready to return home and to return to outpatient services where they may continue to gather gains that were made in the hospital. Children will have activities on the units, but will also go to meals in the cafeteria or to the gym or art therapy rooms that are located off of the unit. Our staff will do everything we can to keep your child individually and the group as safe as possible, and to intervene or de-escalate situations before they become problematic. Our efforts are to keep our eyes on your children and to keep them safe. And our job is to have the staff who are trained and available in the service of the safety of your children. We understand that when your child is admitted to the psychiatric hospital, that this is a stressful time for them. As such, it is not expected that they would be happy to be here. Frequently, kids will call home in the early stages of their hospitalization, telling their parents they don't want to be here. This couldn't possibly help them. Our approach involves multiple areas of investigation and intervention. Once your child is brought to our intake department, there is an initial assessment that precedes their admission. They will then come to the unit, and within 24 hours of their admission, they will receive a full psychiatric evaluation and a full physical examination by a pediatric practitioner. It is important that physical health and mental health go together. The psychiatric assessment will involve a thorough discussion of the reasons that the child came to the hospital, along with background information that is very helpful to look at the clinical needs of the child. After assessing the child, the psychiatric practitioner or psychiatrist will get on the telephone and call parents or guardians to discuss the findings and to make recommendations for treatment. The pediatric practitioners will follow up on physical health needs. It is the job of the nurses, the psychiatrists, and the pediatric practitioners to make sure that these are addressed. In addition to the assessments done by the pediatrician and the psychiatrist, your child will also undergo a psychosocial evaluation by our social workers. This will also include a telephone call to you to get some of the background information. We know that much of the stress that kids are under comes from school, family life, community, and appears in other settings. It is important to understand this comprehensive view of both the physical, mental, and social elements to come up with a good treatment plan that will benefit your child. After conducting their psychosocial evaluation, the team will get together and develop a treatment plan which is based on a problem list. For example, those things that might lead to a hospitalization. These types of issues are addressed in the treatment plan with a plan laid out for the treatment team to follow to move towards resolution of symptoms, safety, and the ability to return home for treatment. Social workers may contact you for family sessions where, through Zoom calls, you may be face to face with your child with the mediation of a social worker to discuss ways to negotiate and reintegrate once the hospitalization is ready to be done. On the unit, there are groups that are held regularly that are oriented to trying to help your child manage stress, as well as deal with some of the social skills that they need where they may be having issues of anxiety or other problems that show up in school and other settings. Typical groups include expressive therapies, coping skills groups, and stress management groups, as well as psychoeducation, where kids will discuss what treatment means and how it might proceed. On the unit, children will also be involved in activities of daily living. This is a big part of their stay here when it's time for meals, when it's time for hygiene, and when it's time for sleep. An important part of your child or adolescent's hospitalization is the discharge planning. This begins from the initial assessments. We're thinking about what sorts of services would be appropriate after your child is ready to leave. It's critically important that these services begin quickly, and our case managers will be reaching out to programs in your area to secure a place for your child so that they could begin therapeutic services shortly after they leave. There may be recommendations for different levels of care. Some children may be appropriate for once a week outpatient therapy after they leave. Others may need something more intensive, like intensive outpatient services, which tends to be 3 to 4 hours a day, 3 to 4 days a week. Partial hospital services, which is a daily program for 5 to 6 hours a day. Or in some cases, there may be discussions with parents and guardians about residential services. These are important discussions. The treatment team expects to have them with you and hopes to be very helpful in securing the proper services for your child. I'm often asked whether or not children are able to have personal items with them when they're in the hospital. Well, telephones are not allowed. There are phones available, and you may call your child during the day. And if they're not in group, they can be brought to the phone to talk with you. They have the ability to call out during certain hours of the day. If there is a need to limit some of that phone calling, you will be consulted because it would be up to you to restrict those phone rights for your child. When it comes to being contacted on the telephone, the psychiatric practitioner will always talk to you before starting any medication. Then, if there are dosage adjustments, you can expect to hear from them and discuss these with you. Remember, your consent is essential for each of these steps. You can expect to hear from the social workers who are doing the psychosocial evaluation or to schedule family sessions to discuss aftercare plans and to prepare for discharge. Nursing staff is available, but in a limited way, and they will let you know the best hours for them to be reached to give you a brief progress on how your child is doing. Families and children can meet in the cafeteria for approximately a half an hour. Please arrange your visitations. You'll sign in at the front, and your child will be notified that you're here for a visit.